I illustrate the case of a 77-year-old female who presented to the emergency department for chest pain. Her ECG showed SD depression in V3 through V6. She was given heparin and nitroglycerin infusions. Few hours later, on admission in our cardiology department, she was pain-free with stable vital signs. No anymore SD depression. Her examination was remarkable for a grade 3/6 systolic murmur on the precordial area. And now I will show you what I observed during the echocardiographic exam. The four-chamber view. Something goes wrong with the mitral valve. The anterior mitral leaflet touches the interventricular septum during systole. It's a typical SAM, Systolic Anterior Movement of the mitral valve. Here is a slow motion of the phenomenon. We may distinguish two abnormal blood flows with two different convergence areas, a mitral valve regurgitation flow and an obstructive flow at the level of the left ventricular outflow tract. And here is the continuous wave Doppler sampling of the mitral regurgitant flow. Very high velocities, it means very high atrioventricular systolic pressure gradient. And here is the C-wave Doppler of the intraventricular dynamic obstructive flow, very high velocities, over than 7 meters per second. It means over than 180 millimeters of mercury of systolic gradient. It means quite 300 millimeters of intraventricular systolic pressure. Observe the three-dimensional binocular shape of the left ventricular outflow tract produced by SAM. The patient was treated with beta blockers and mild hydration. And now I will present the results. No significant cardiac murmur was still present. And now observe the mitral valve. A mild degree of systolic anterior movement was still present. No significant dynamic obstruction on the left ventricular outflow tract. Only few and not recent similar cases reported in the literature.